Indiana, Dr. Boustany.
Gentleman's recognized for 2 minutes.
Thank you, Madam Speaker. I rise in favor of repeal of this bill because it's going to fail on cost, it's going to fail on coverage, and it's going to fail on quality. First, cost. Premiums are going up. In fact, they're going up even higher at a faster rate than they would have if we had done nothing in many cases. With regard to the deficit, there are a number of gimmicks in this bill, double counting, excluding the doc fix, creating new entitlements such as a class act, which is a Ponzi scheme. And finally, it does not account for the discretionary spending for this massive increase in the bureaucracy that's going to be created. Taxes are going to go up on innovation, especially medical innovation. On coverage, what kind of coverage are we expanding? Medicaid coverage. That's a ticket to the emergency room. It doesn't lead to a good doctor-patient relationship. And it's ultimately the most expensive and inefficient way to provide health care. And those costs are going to be passed on to the states. And on quality, let me relate an instance from my own medical practice as a cardiovascular surgeon. I was once called to see a patient who was 101 years old. 101. He had carotid artery blockage and was getting ready to have a stroke. He had imminent symptoms. And I was skeptical. I went to see the guy, and this fellow was vigorous, strong handshake, lived by himself, independent, worked in his own yard, took care of himself without any help. And so I chose to do the carotid operation on him. Thankfully, it was successful, and I gave him 6 more years of high-quality life as a result of this. He died from some unrelated cause later. But in the absence of that, he would have had a stroke. He would have been in rehab, in a nursing home, acute care, lots of expense, no quality to his life. Madam Speaker, there's an art and a science to medicine, and the art involves a doctor-patient relationship. It's built on mutual trust and understanding, knowledge of the patient, trust on both the patient and the doctor's part to do what's in the best interest of the patient. But not only that, the doctor-patient relationship is where costs are incurred and quality occurs. This gentleman would not have had the quality of life if he had not had this operation and if this law had been in existence, which would have delayed or prohibited such treatment.
Time
I yield
expired.
back.
Gentleman from Michigan.
Could I ask you, Madam Speaker, how much time there is on?